Welcome back, everyone. Just a few moments ago, I told you how when it comes to insurance, United Healthcare, one of the largest in the country, and the Healthcare Technology Group is a subsidiary called Change Healthcare, was actually hit by a major cyber attack that's disrupted a number of systems. And the healthcare community is very concerned about this. Your medical prescriptions, your equipment, and hospitals are all being impacted. So I have with me today Steve Sella. He is president and founder of Strategic Office Support, who actually works with a number of these organizations around the country. And you talked about hospitals.
Yes.
How many hospitals in this country are now being impacted because of the cyber attack?
So basically 5,000 hospitals all across the nation. The American Hospital Association came out and said that there's not a hospital that isn't impacted. The Change system allows you to verify eligibility, which is essential, to know what benefits are. It allows you to process payments and things like that. And it's the largest in the nation, right? It's 15 billion transactions per year, touching 1 in every 3 Americans' lives, basically. So,
and if somebody can't get approved for a transaction, they can't get the service, they can't get prescriptions, they can't get probably a medical procedure unless it goes through, right?
Absolutely, and the provider's sitting there basically blind. They can't see your benefits, they can't see what they're going to charge you, if they're going to get paid. So you can imagine they're reluctant to provide the service or provide the medication or provide what they need to provide because they don't know if they're ever going to get paid on this.
Right.
So it's hugely, hugely impactful. And a cyber attack like this just underscores what could actually happen, right? The impact it has. This is not just, one little isolated incident, a ransomware. This affects everyone, right? And we're talking critical things. People that need medications to live on a daily basis, right? O2, oxygen, and ventilators and things like that. So hugely, hugely critical.
Right, and you work with so many of these people around the country.
We do.
With these products. So now, another question I have is, what is somebody supposed to do if they realize that I can't get my medications, my insurance is not being approved because there's this stopgap to try to prevent any more of our private information to be disseminated to, I guess, the black web? What do people do in order to get the things that they need?
That's a great question. And, first and foremost, having your credit on lockdown where you have some kind of security, it's a free service. You can call one of the credit agencies and lock your stuff down so you know. That's huge. But as far as interacting with your providers, be patient with them. Talk to them. They're trying to work through all this as well, but it's a frustrating situation. So if you just understand them, where they're coming from, and that's why I'm really here, so that patients will understand. You may have to come out of pocket. You may have to come out of pocket, or if you have a long-standing relationship with a provider who knows you, they might probably provide service and then get payment once this is all fixed up. And it will be fixed 1,000%. It's just a matter of how long, right?
Right. And also, if you end up getting strange phone calls, I'm just going to throw this out here right now, from people who say, oh, well, we know there's a problem, and we want you to provide us with such and such and such. That could be somebody who now has your information from the dark web who is trying to use you to get even more. So you got to be cautious of that too, right?
That is such a great, absolutely. And with AI and deep faking, that is a great point. That's right. Anyone calling you asking for personal information, that should be a hard no unless they can verify, or you can call them back at the proper place, right? For sure.
Why do you think it's taken so long from February 21st to now March 1st for us to learn about all of this?
Yeah, well, it's something that people don't realize. I think the pandemic brought what home health really brings to the table. Essentially, we're all going to be touched by home health companies, right? They're just kind of like the unsung heroes. They're in the background, but it's a huge, huge thing. And so I think it's this, getting the word out there so people see. People immediately saw pharmacies and hospitals, right? But there's all these home health companies that provide critical services on the daily. So that's who we work with, and that's really what I've been a part of basically my whole career. So yeah, it's very, very important to know that. And also important, don't panic. Don't panic. These are good people, right? These are people that take care of you. They have your best interests in mind. It is a frustrating situation. Keep your receipts. Keep your receipts. Ask for hard copies of your prescriptions when you go to the doctor, because you may need that in order to process it later. That would greatly help you. And on your screen, we're just showing you from the cyber attack itself, from what the press release was releasing, just letting us know that experts are working to address the matter, and they're working closely with law enforcement and leading third-party consultants to tackle this. Of course, you can go to our website, CW39.com, after our show to learn more about this and how you can protect yourself from
any type of fraud when it comes to cyber attacks in cybersecurity. Steve Stella, thank you so much for being with us and letting us know about this and just bringing attention to something that is important to people. Our healthcare is so important to keep us alive.
It's vital.
So we got to make sure we take care of it too. So
thank you so much. Appreciate you.
All right, and everyone, let's go live now to a look outside. It's the Galleria area. We're CW39 Houston. No wait weather and traffic.